And now it's time to head to the Fox 11 Fieldhouse. The following segment is brought to you by Aurora BayCare Medical Center. And here's Benny Peterson. Hi, Benny.
We are here this morning with Dr. John Awowale, an orthopedic surgeon who is fellowship trained in sports medicine at Aurora BayCare. Now, Dr. Awowale, today we are discussing shoulder replacement and the latest orthopedic techniques. And Aurora BayCare has everything under one roof, from diagnosis through rehabilitation. Now, can you explain what that all entails?
Yeah, absolutely. Anytime there's a patient that we determine would benefit from a shoulder replacement, we take a personalized approach. We explain the pre-surgical screening to the rehabilitation after surgery. Kind of the goal of that is just to convey to the patient maybe the pre-surgical medications they may be taking, any sort of surgical techniques that I'd be undertaking in the operating room to get them a better outcome, as well as post-operative physical therapy and post-operative pain medication. The goal is really to have a good long-term outcome, as well as pain relief during the recovery process and just getting patients back to the things they love to do.
And Aurora BayCare offers innovative treatment options such as a reverse shoulder replacement. Now, how does a reverse shoulder replacement compare to a typical shoulder replacement?
Yeah, that's a great question. So when you have hip and knee replacements, people are kind of more familiar with those. It's the same type of process in the shoulder. We basically take out the arthritis and put in components to alleviate pain where there was arthritis before. Now, in a standard shoulder replacement, we replace the ball with another ball and the cup with another cup, and that gets rid of people's pain. But in certain situations, patients have some rotator cuff tears that can't be repaired. In that case, we'll do a reverse shoulder replacement where we actually put the ball where the cup was in the cup where the ball was, and that actually alleviates some of the stress on the rotator cuff musculature and gives people pain relief as well as some more range of motion.
And when do you recommend patients reach out to a shoulder specialist like yourself?
Any patient that's experiencing shoulder pain that just basically disrupts their daily living. If they're having pain with any discomfort throughout the night, night pain that wakes them up, any sort of problems with mobility in terms of getting around the house, playing with their grandchildren, or patients that have a lack of range of motion. So it might be difficult to comb your hair or reach up on a high shelf. Any of those patients, we'd like to see them in clinic and kind of take a look and see if we can get them back to doing the things they love to do.
Wonderful. Thank you, Dr. Awowale.
Yeah,
now,
absolutely.
for more information on Aurora BayCare's specialized orthopedic teams, head to aurorabaycare.com/ortho. In Good Day, Wisconsin, we'll be right back.